In this recording, I will discuss the importance of talking about anatomy, using proper language when discussing anatomy, and the importance of describing the bodily process of pregnancy and birth to children and adolescents with intellectual disabilities. Foundational conversations with young children will promote better communication with an adolescent, but it is never too late. You can start talking with your child today about anatomy with the following guidance. As a reminder, each of these training sessions are brief and should not be considered a comprehensive curriculum on the specific topics covered. Each family is encouraged to determine what information and activities are appropriate for their child. Using correct terms and body positivity. When speaking with your child or adolescent, it is important to always use correct terms for their anatomy. You will want to teach correct names of the body parts, which includes their genitals. As you are teaching a child their body parts and anatomy, say to them, point to your toes, knees, penis or vagina, belly button, elbow, chin, and so on. This teaches the child that their genitals are part of their bodies and nothing to be ashamed of. Continue this dialogue with your child as you move to potty training. You may say something like, once you are done going to the bathroom, be sure to wipe your penis or vagina so you do not have any pee on you. If your child uses a nickname that was learned elsewhere, acknowledge the different term. Yes, there are a lot of names for these body parts, and the correct names are ... whatever it is that you need to insert. These conversations will help you and your child to communicate about their anatomy if there were ever to be any health issues, injuries, or sexual abuse. By having an open and accurate conversation about a child's body, you will build a foundation where a child or adolescent can later come to you with questions or concerns as they continue to develop and mature. It is not too late if you have not established these communication habits. You can begin today by naming all body parts accurately and conveying that the body and its functions are natural and healthy. As you discuss bodies within your home and as a family, remember you want to encourage your children to have a positive body image and self-confidence. To help children feel good about their entire body, teach them about anatomical differences between males and females while maintaining that all children are equally special. Be sure to not show any discomfort in your facial expressions or in your tone. Your body language needs to match the message that all bodies are good bodies. Specifically for older children and adolescents, continue to use shame-free language and provide information about their changing body. As your child matures and continues to develop, you will want to teach both internal and external anatomy of their bodies and discuss the basic functions. You will want to talk about these topics even if your child does not specifically ask. That way they know you are a trusted source to go to for such information. Acknowledging the difference between bodies. When acknowledging the difference between bodies, always use correct terms to refer to your child's body parts. You may say something like, you have many body parts. They all have a purpose. They are all wonderful, and you are wonderful. Then go on to explain, people have lots of body parts in common, but these body parts can look different on different people. Some people have a penis, and some people have a vagina. More explanation will need to occur as your child becomes curious about reproductive organs and systems that occur for males and females. As kids get older, they start to better understand how bodies are different and will have more questions. These questions may be better discussed in private. Understand that it is okay if you do not immediately know how to answer your child's question, or if you want to wait until you are in a more private or comfortable setting to talk about these questions. You can respond by saying something like, "That's a great question, but it is kind of hard to explain. Can we talk about it at home?" Note, if you say you are going to talk later, make sure you keep your promise. Ignoring the topic will not make your child's curiosity go away. Instead, it sends the message that they are not able to come to you with questions related to their inquiries. In the end, it is up to you to decide how much detail you want to provide your child related to the differences in bodies. Your decision should be based on the conversations you have already had with your child and what you think your child is ready to understand. Remember that you will have many of these talks, so do not feel pressure to teach your child everything in one long speech. Talking about pregnancy. When talking to children about pregnancy, the younger the child, the less detail they need. Often a simple and honest explanation is sufficient. If your child wants more information, they will let you know. If your child asks, "Where do babies come from?" you can say, "A baby grows in a uterus and comes out of a vagina," or "Babies are made with bodies." Babies grow inside a uterus, which is part of the body. That may be all that it takes to satisfy their curiosity. If they ask, "How does the baby get in the belly?" you can answer while still being age appropriate. You do not necessarily need to describe all of the detail of penis and vagina sex. For example, you can say, "Most women have tiny eggs in a special part of their belly. Most men have very tiny seeds called sperm. Sometimes, when two grown-ups are together, the seed and egg can meet and make a baby." As you are describing this process to a child, remember that children are very literal. You'll need to explain that people do not have eggs like a chicken or seeds like plants, and that a plant will not grow inside the uterus. As children get older, you can fold in more detail. Sometimes during sex between two grown-ups, sperm comes out of the penis, swims up through the vagina and into the uterus looking for an egg. For pregnancy to happen, you need to have three things: an ovum, which is your eggs, a sperm, and a uterus. If the sperm and egg meet up, it can start to grow into a baby. The baby grows in the uterus for 9 months and then comes out through the vagina or a small cut in the stomach. It is normal for younger children to be pretty impressed by the new information they learned and want to talk about it a lot. So while it is important to help your child feel comfortable talking about these topics, it is also a good idea to teach them about respecting people's boundaries and your family's expectations around these conversations. For example, a grocery store, the bank, or even at school may be inappropriate locations or less than ideal times. You can delay the conversation as long as you follow up with your child, or you may wish for your child to seek out other appropriate adults. If you wish for your child to discuss these topics with others, you can help them identify other safe and trustworthy adults in their life, like a co-parent, grandparents, or other family members to talk about where babies come from and pregnancy. You may want to also include how to talk about reproduction in an inclusive way that does not leave out gay parents, trans or gender non-conforming parents, and families who came together through adoption, surrogacy, or reproductive assistance.